Let's speak with the Chief Executive of the Institute of Alcohol Studies, Katherine Severi. Dr. Katherine Severi, good afternoon to you.
Hi, good afternoon, Ian.
Listen, it's Christmas. A happy Christmas, by the way. I think we can we can safely say that. And of course, who doesn't like a swift prosecco or a crafty glass of wine, etc. But we're talking about something far more serious here. Clearly, people that developed either a dependency, had some kind of horrendous reaction. But if we have 150 people a week, I roughly worked it out to are dying because of alcohol, and it's perfectly legal.
Yes, agreed. This is a very concerning trend, and it reflects a long-term trend in terms of increased alcohol deaths, but something that really accelerated during the pandemic. So the 42% increase is between 2019 and 2023. So it really reflects the change in drinking patterns and the health service response to COVID. So what we saw was a polarization of drinking habits. We saw some people get very healthy, do lots of exercise, eat lots of fruit and vegetables, and cut down on their drinking. But then we saw other people during lockdowns who were already heavy drinkers increase their intake of alcohol. And it's possibly this cohort that we're now seeing come through in the very tragic statistics that we're seeing in terms of alcohol deaths. And we need to remember that behind every statistic is a family, loved ones, a community that's experiencing loss. So it's something that we're really urging the government to take a good, hard look at as their New Year's resolution for 2025. So I'm ending the year, despite these being some very tragic statistics, I'm ending the year optimistic and hopeful for next year.
There's a school of thought, of course, that minimum pricing isn't necessarily the answer. There are other things more about education and awareness, etc. Although I'm tempted to say, Katherine, that I think everybody knows, don't they, that if you drink too much, it's going to be very bad for you. It's like smoking, it's a known thing. Mixed results in Wales and Scotland where they've tried minimum pricing.
I think you raised some really important points here. First of all, yes, we do need multiple measures to address this really important problem. So there unfortunately isn't a magic bullet that we can change things overnight. Minimum unit pricing could be a really important tool because we have seen significant reductions in deaths in Scotland where it's introduced. 13% reduction compared with Northern England. And for the first time this year, we saw deaths in the northeast of England overtake deaths in Scotland. Now, that's really concerning because we're seeing the Scottish figures move closer to the better trend and the English data moving in the wrong direction. And then if we think about information education, you're absolutely right. With smoking, we've seen some really terrific results with everybody being aware that smoking causes cancer. But we haven't seen any public-backed alcohol health information campaigns to make people aware of the health risks associated with drinking. So, for example, very few people know that there is a direct link between alcohol and breast cancer or bowel cancer. Now, I think it's really important that the public and consumers are equipped with all the facts before they decide how much and if they want to drink. So this is something that we would really like to see in a government alcohol strategy, and we'd love to see the government get going on preparing one as early as possible in 2025.
What's your take as a clinician and as to why Britain has an alcohol problem? I know, the French like their wine, the Italians like wine, the Germans like beer. I'm slightly stereotyping here of the nations, but you take the point. But the manifestation of alcohol consumption has always felt rather different in this country. Can you pinpoint what you think is going on there? What's behind this? I know lockdown could be a factor in this, where people were going out of their mind with solitude and the like. There was a sense that it was the only way to stay sane. So there could be that, but this problem does predate lockdown.
Indeed, and for transparency's sake, I'm not a clinician. I'm a research doctor.
Okay, right.
But I do look at research all the time as part of my day-to-day job in drinking trends. And I would say that if we look at what the World Health Organization says drives alcohol harm, and they are three major things. That's the affordability of alcohol, the availability, and the promotion, so marketing and advertising. Now, these three major drivers are extremely prevalent in the UK, whereas once we used to be a nation of pub goers, now 80% of all alcohol sold and drunk in the UK is from shops and supermarkets and is consumed behind closed doors, as opposed to in the jurisdiction of a pub where there's a landlord with a duty of care to moderate people's drinking. We've also seen increased availability in terms of extremely cheap supermarket alcohol that can be delivered to your doorstep following COVID. We've seen these, promotions extremely prevalent. So I would say that as a society in the UK, we are subject to the big three drivers of alcohol harm. So these are the three areas that we would expect a government to look at to tackle this growing problem next year.
There it is, Katherine. Thank you for your time. Really appreciate that. Dr. Katherine Severi, Chief Executive at the Institute of Alcohol Studies.